mysteries. One woman's nose was constantly running. Constantly. Was it a cold? Was it allergies? No. And you will not believe what it was. Watch. Kendra Jackson is a woman who values family. But in 2013, she nearly lost them when she was involved in an accident, changing her life forever.
A little lady just come out of nowhere and hit the back of my van. And I had just come out of my seatbelt, so it slung me all over the front of the van. And I remember falling back into my chair and didn't know that I had broken my shoulder.
After having surgery to repair her shoulder, Kendra noticed she constantly had a runny nose. At first, she thought it was just a cold.
It felt like I was drowning in the fluid draining the back of my throat. So I would sleep sitting up a lot of the times. Then when I did doze off and get a good sleep, when I wake up, my pillow would be soaked.
Kendra saw multiple doctors trying to figure out what was wrong.
I had went to a specialist, and he looked at my nose, ENT. He said, "Oh, I don't see any polyps. There's nothing there. Wait till the first frost we get and cold, and it'll stop." This in October.
Over the next 5 years, her condition worsened until one doctor figured out the real reason why her nose was always running. And Kendra Jackson joins us now with the answer. Welcome, Kendra. Great to have you.
Good to be here.
So you finally go into this doctor's office and you say, "I'm not leaving here until you figure this out."
Yes.
And what did they tell you you had?
She came back, well, she left. She came back in. She said, "Well, looks like," I explained the story to her, and she said, "Well, it sounds like you have CSF." And I said, "Well, what is that?" She said, "Cerebral spinal fluid." I was like, "No." And I was like, "Really?" She's like, "Yeah." I said, "It's coming from my brain?" She said, "Yes."
Brain fluid was leaking.
Yes.
What was your reaction to that news?
It floored me because I knew something was wrong.
You knew all along. And was it caused by the car accident?
I believe so. They said, upon impact, when I hit my face on the steering wheel in 2013, when I was in a bad car accident.
How bad was the running? Because, a lot of us have constantly runny noses thanks to allergies or what have you. So how did it compare to just, it's running, I have to use a tissue a few times a day?
Well, I used a box of Puffs every other day. That's how bad my nose was running. But upon impact, it didn't start till a couple months later. So around 2015, it just started running more and more and more. And then it just wouldn't stop. So
now, without getting too gross, was it like clear?
It was very clear, just like water.
So there wasn't anything different about it than when you have a cold and you have a runny nose?
There was no color.
So other than just the number of times you had to deal with it, like the frequency of the issue, you had no clue that this was brain fluid?
Right, no clue.
All right, so your rhinologist, Dr. Christie Barnes, who's at Nebraska Medicine, is with us as well. Dr. Barnes, thank you for being here.
My pleasure.
So you performed the surgery on Kendra to fix this?
I sure did, yeah.
All right, and is it true at one point in our history you would have had to open up her skull to do this?
Yeah, 10, 15 years ago, she would have had a big incision across her head. You would have had to open the skull and then repair it from basically the top down.
But how did you do it?
So I did it through the nose, with a tool called an endoscope, which is a long camera that has a light at the end. And I went through her nose and sinuses and identified the leak and repaired it from inside her nose.
We actually, I think, have video of the surgery itself, which is miraculous. Look, this is it, which is, what are we seeing there, Doc?
So this is the inside of her nose. We're looking at, this is just normal structures inside her nose. But that very long camera there that I'm using. So all long, skinny instruments. It's
helped you fix it.
Fixes it.
So
yeah,
can I ask you, because there are
invasive.
going to be a lot of people sitting at home right now going, "Oh my God, I have brain fluid leaking out of my nose right at this minute."
I know.
So how do you know if it's brain fluid?
So there's some very key things that are very much different with her story and with what you'll have with brain fluid than just a runny nose. You'll have a salty taste, correct?
Yes.
Yeah. And it's usually copious, and it will be one side versus the other, right? And the other thing that is pretty prevalent is it's leaning over, bending over, straining, those sort of things. Increase the pressure inside the head, and that's what really causes that.
And would you have had to have a brain injury? I mean, like if you...
The most
You know, if you
common
haven't had a
reason-
car accident
Yeah,
or
the most
something?
common reason for a CSF leak is head trauma or some sort of sinus surgery. It's not a very common condition, as you know.
Wow.
But yeah, head trauma is very.
How you doing now?
I feel great. I'm just still a little tired.
Yeah,
I
you
want to
s-
sleep all the time.
I can relate to that, even without. I'm so glad you figured it out and that you were your own advocate. Good
Yes.
for you, Kendra. All the best to you. Hang
Thank
in
you.
there. Wow. Dr. Barnes, thank you as well. We have more of Kendra's story on our website, today.com/Megan Today, and we'll be right back.